Welcome to Airborne on staugustine.com. I'm your host, Matt Jeffs, bringing interesting people from your world so you can stay dialed into your community and the folks who make it tick. We have with us today Pierre Angier. Pierre, welcome.
Thank you.
You're a doctor of osteopathic medicine, is that correct?
That's correct.
Would you explain to our viewers what osteopathic medicine is, or a DO?
Well, a DO is a fully licensed physician.
Mm-hmm.
As an osteopathic physician, I can prescribe medications. I've done surgery. I've delivered babies. I work in urgent care centers sometimes. So I can do everything that an MD can do.
Mm-hmm.
But also, I can do everything that a chiropractor can do.
Is that right?
Part of our training is there's a strong emphasis on the musculoskeletal system in osteopathic training. And we're taught to do spinal manipulation, which is basically the same thing that a chiropractor would do.
Mm-hmm. If I recall, in some reading I've done, osteopathic medicine predates chiropractic, if I'm not mistaken.
It does. Some of my chiropractic friends don't like to hear that, but from what I understand, that's true.
But again, you're able to prescribe medications if someone needs it, and anything that an MD can do?
That's true. Our training and our licensure is considered equivalent to an MD. So that does open up a lot of avenues and options for people when they come to me for care.
Now, you are the owner of the Get Well Clinic. Is that what it's called?
Yes, it's called Get Well, the Center for Osteopathic Medicine.
What do you mean by Get Well? Tell us.
It's obviously designed to send a message.
Right.
My practice is geared towards wellness. We promote healthy lifestyles and try to coach people on how to maintain a healthy lifestyle. A lot of us know we shouldn't eat certain things, we shouldn't drink certain things, we probably got to exercise more, but doing it is what's tough.
Right.
So one of the things that I did not get in medical school, and I've never talked to a physician that has gotten this, we're not taught how to coach people. Usually when you go to the doctor, he'll say, listen, you need to eat better, you need to do this or do that. Or maybe he'll even hand you a diet.
Right.
But that's not enough.
No.
People aren't going to change their lifestyle based on that typically. So I took a program called the Well Coaches Program. It's a 3-month curriculum that works on helping people make small changes, and so they're more likely to be successful over a period of time.
Right. Right. That's something that's very hot these days, isn't it? A topic in terms of our changes coming.
Right.
Anything that you see on the horizon that maybe we should watch out for or keep an eye out for in terms of healthcare delivery yet?
Well, I think there's going to be some good things that come out of the healthcare plan, but I think it's going to be a very difficult transition. And again, for that reason, I think it's best to avoid having to get health care, or really disease care is what we offer.
Right.
In today's world.
Right.
I think the best way is to focus on staying healthy so you don't need to go to the doctor as often.
How did you get interested in nutrition?
Well, I had always been interested in nutrition and did my undergraduate at the University of Vermont in nutrition. I have a Bachelor of Science in it.
Really?
I've always just found it fascinating, and I was always baffled why medical schools didn't cover nutrition, since that seemed to be a really important part of good health.
Right.
Knowing that I wouldn't get a lot of training in it in medical school, while I was doing my pre-med, I also got a major in human nutrition.
And that served you well, I take it, in terms of your practice?
It has, yes. I really enjoy talking to people about it. Sometimes I think they're skeptical that a physician would know anything about nutrition.
Isn't that an indictment, I guess I should say? You're right, that unfortunately many don't, and yet it's vital, isn't it?
It is. It's interesting, only 30% of medical schools have any real serious curriculum for nutrition at this point.
It sounds to me that you really get to know your clients, that you, can I use the term interview them, or is that part of the consultation? Because you've got to learn what motivates them.
Well, yes, I spend a lot of time with my patients in my own office. I also mentioned that I do work in urgent care. Urgent care is essentially triage. And you don't spend a lot of time. It's a 5-minute visit. And that's what most people experience when they go to the doctor, is a very brief visit. And lots of times they walk out having to pay $150 for that.
Right.
And they're understandably dissatisfied with that. In my office, I typically spend over an hour with a first-time patient, sometimes an hour and a half.
One-on-one with a doctor for an hour, that's unheard of. That's phenomenal.
Well, I think the first visit is very important.
Right.
And I like to get as much information as I can and get started on the right foot. But even my follow-up visits are usually at least 30 minutes. And we only charge $78 for that.
Wow.
And the reason we're able to do that is I don't accept insurance except for Medicare, which you almost have to accept.
Right.
But, we're able to do it at a great discount because we don't have a lot of the administrative costs that other practices have. So it's more enjoyable for me.
Right.
And I think people get more bang for their buck.
Now, you offer a range of services, and one of them is chelation. What is chelation?
Well, chelation therapy has been around for 40 or 50 years. A lot of physicians are familiar with it and have administered it for the treatment of lead poisoning.
Yeah.
EDTA chelation has been the standard of care for 40 or 50 years for lead poisoning. But they found that it had another use, and that is that it can help with cardiovascular disease. We have been using this, well, let me say that the medical profession has been using this successfully to treat things like peripheral vascular disease, coronary artery disease, and even to improve cerebral blood flow by reducing the plaques in the carotid arteries.
Do you have an interesting story about chelation or an experience that kind of turned you on to it?
Well, yeah. As a matter of fact, I had patients that were going to get chelation therapy, and I was very skeptical of it. But they seemed to be getting better. I couldn't argue with the results. And I looked into it. I read a couple of books, but at the time I was doing other types of medicine, and I had no interest in providing this as a service. And then when I was 44 years of age, I started having angina, which came as kind of a surprise because I was very active and I thought quite healthy. But I couldn't do any exertion without having left-sided chest pain. So I did see my cardiologist, and I saw several cardiologists, in fact. Got a full workup, and the upshot of it was they said, listen, we can't really help you. They tried a few different medications. They didn't work. They said, take some nitroglycerin and exercise more. I said, but when I exercise, it hurts. They go, well, we can't really help you. So I went to a place called the Mount Rogers Clinic in the mountains of Virginia, one of the best-known chelation clinics in the country. Dr. Elmer Cranton started it many years ago. And I went there for a week and received several treatments and learned how to do the treatments as well. And went home and had my nurse administer the rest of the 25 treatments, because most people get at least 25 treatments to start with. Within 2 weeks of starting the treatment, my chest pain went away.
Wow.
I felt like $1,000,000. I felt energized. I had no pain. I really couldn't believe it, and neither could my cardiologist. In fact, he still doesn't believe it to this day. But it's the only thing that I did differently. So then I learned something else. In receiving the treatment, you're in a room with a number of other people. And there were quite a few, mostly elderly people there, who seemed a picture of health. And they had all these stories that they told me about how they had chest pain or problems with circulation in their legs or other issues. And they went and got chelation and got better.
If folks would like to learn more about the Get Well Clinic, what's the best way they could find you?
Well, they can call me. I'm always happy to talk to folks.
What's that number?
Our number is 904-217-7030.
Do you have a website?
Yes, it's www.getwellfl.com. GetWellFL.com.
And where do you practice? Where is your clinic?
My practice is just up off from 210, just 5 miles north of the World Gulf Village. And the address is 109 Nature Walk Parkway, and we're in Suite 101.
Pierre Angier, thank you so much for getting airborne with us. I hope you can come back and share with us your knowledge on all sorts of subjects. I think this approach is fascinating.
I look forward to it.
Thank you so much. You've been airborne with Matt Jeffs on staugustine.com, bringing interesting people from your world so you can stay dialed into your community and the folks who make it tick. See you next time, everybody.
Airborne rocks.